Afternoon. Everyone all set? Okay. Thank you for joining us here today for our COVID-19 update for September 16th. I'm joined by our Health Commissioner, Dr. Gail Burstein, as well as Karen Gambino from Deaf Access Services, who will be providing the American Sign Language for today. Just jump right into it. As of yesterday, we had 10,567 total positive cases. These are not duplicates. These are individualized cases. So it's not one person having tested positive twice. Out of 374,609 specimens that were tested. So that means 10,567 Erie County residents have tested positive since the beginning of the COVID-19 outbreak. 689 people have died, unfortunately 7 in the past week. Our Department of Health epidemiology staff confirmed a number of those in the last 36 hours. The majority of those who passed away in a nursing home setting. These were all lab confirmed cases before death, so they all had COVID-19 while they were alive. There are no presumed positive cases. These are all individuals who had COVID-19 and died as a result of the illness. On September 14th, there were 25 individuals admitted to Erie County hospitals, 6 were in the ICU, and 3 individuals had an airway assist. You see the data associated right here. As of the 14th, we had a little rise, a little less than a week ago, approximately a week ago, when we were up to 31 cases. We've seen steady decline in both admissions to the hospital as well as even the ICU, though as you note there is the increase in the death total there. And in Western New York on the 14th there were 29 individuals hospitalized, 10 in the ICU. COVID cases by age and gender, this really hasn't changed a whole lot in the last couple of weeks or few weeks, which has basically shown that the growth is primarily in younger adults. For the longest time the bars on this graph were very similar in height. Now we're starting to see the 20 to 29-year-olds really kind of take off. And we're seeing growth in the 15 to 19-year-old age range as well. For the cases that were confirmed last week, with the week ending September 12th, there were 370 total cases, new cases, of which the largest proportion were in the 20 to 29 category, but the second highest was 10 to 19. We decided to do a little bit deeper dive into those numbers to determine who's catching it, and basically by age range, especially when we saw the increase in the 10 to 19-year-old. And what we've seen, actually, I don't know if I have that next. Yeah, I want to go straight to this one. For last week's cases in the 10 to 19-year-old category, 6.6% of all 10 to 19-year-olds who tested positive. So the week before it was 20 to 29-year-olds. This past week it was 10 to 19-year-olds. And 57% of those 78 cases were actually in the 17, 18, and 19 years old category. So what we're seeing are those on the higher end, often individuals who may no longer be in high school, but in a college setting, 18 or 19-year-old, were testing positive. And we confirmed that the vast majority of these cases of individuals that may have been high school or primary school age are individuals who truthfully did not attend school because they were in virtual settings. So for now, you've heard from the school districts when they've released information with regards to caseloads in their districts. We can confirm that while the numbers seem higher than what you would expect based on what's been announced by school districts, almost all of those individuals either are not in school, or if they are in school, they've been in virtual settings and have not attended class with other students. So we don't want to scare people. We did want to confirm that, and we did. So when you've heard of cases in particular school districts, we can confirm that's true, and there are no outliers that the public doesn't know about, but there are individuals in those age groups who've tested positive. They just haven't attended a classroom setting. Going back, looking at last week's positivity rates, 187 of the cases were from the city of Buffalo, which was a 2.2% positivity rate. And those outside the city of Buffalo, it was 183 cases, which is a 1.4% positivity rate. So the positivity rate in the city of Buffalo was more than the other one, not exactly double, but about 70% higher. So we just are keeping track on that. The total for Erie County last week was 1.7%. And just looking at these age groups again for last week, you will note that when it comes to the older age categories, they generally are better than the younger age categories, which we've seen recently. Less people catching COVID-19. We think a lot of it has to do with individuals in the older age categories just taking additional precautions, knowing that they are more at risk for serious illness. Cases in Erie County by gender and residence, these are total cases. This number has been pretty average for the last couple months, to tell you the truth. Nearly 56% of all cases are females. And when you look at it by residents, nearly 48% of all cases are from the city of Buffalo, even though the city of Buffalo only makes up 28% of the population of Erie County. Something, I'll turn it over to the doctor to talk about, but we've had a lot of people saying, well, nobody's testing positive, this is all BS, so to speak, and the answer is no, there are people testing positive. And I'll turn it over to Doc to talk a little bit more. Doctor, I get yelled at again. Okay. 62% of all cases from the last 2 weeks are individuals who actually had COVID symptoms. So they were sick.
Thank you. Thanks. So on, as the county executive mentioned, that there are a significant number of people who are symptomatic, who are diagnosed with COVID-19, almost 2/3. However, there's also, I think, a surprisingly high percentage of people who are diagnosed with COVID-19 who are asymptomatic. And so I think that really bodes to the reinforcing the strategy that there are people that are walking around with COVID-19 that don't have any symptoms or who have mild symptoms and they wouldn't even think twice about it, and who are infected. So we have to think about that. And those people who are at risk are especially contacts, close contacts, proximate contacts, being in in the same room or classroom for an extended period of time. Or people that have traveled, people who have gone to parties, large gatherings, people who've gone to crowded restaurants or bars, not socially distanced. I mean, that's what we're still finding, those same reports from our contact tracers. So just because somebody looks healthy doesn't mean that they necessarily are healthy. So that's just something that we always have to remember. And then also from the medical literature, I'm sure we've read in the past couple of weeks, there have been publications that are very concerning where people who have been found have been positive for COVID-19, have had very mild symptoms or report no symptoms, have had mild radiographic findings in their lung, like CT or MRIs, and then also changes to their heart. And so even though people may feel well with COVID-19, it's still a really serious infection. And with these changes that are seen on medical evaluations, we don't know what the long-term effects are. We don't know because COVID-19 hasn't been around that long. So this is still a really serious infection, even if people don't develop serious symptoms and were wind up in the hospital. I mean, we still, could have, lifelong type of sequela. So looking at our diagnostic testing and the proportion of positive tests. So again, here is our Erie County graph of number of people tested in Erie County for number of tests in COVID-19, and then the number who tested positive. And you can see for this past week, finally, where our percentage of positive tests are going down. So the past few weeks, they've steadily increased just a little bit, and this past week, it decreased a bit. So hopefully we're going to continue on that trend. But again, it all depends on you. It all depends on people masking and social distancing and washing your hands. So looking at our antibody testing, so remember this is giving us a clue of the proportion of people in Erie County who could have been exposed and infected with COVID-19. Overall the rate is 6.7% of the people in Erie County who have been tested. And, still that it's just, although we hear about COVID-19 all the time, there's still a lot of people in Erie County who are vulnerable to infection. And also, you can see that the number of people who've been tested for antibodies in Erie County has steadily dropped. It doesn't seem to be as hot a test anymore. People aren't as interested. However, it's, it's still good information. And for us at Erie County, we are, offering this test free of charge all over the county. I'll show you where we're going to be in the next couple weeks. So, it's still worth getting if you have any, wondering if you could have been exposed. So now we have to talk about our mortality data, which are very sad. So this is looking at the number of males and females by age group who have succumbed to COVID-19 through September 15th. So you can see as there's a little bit higher proportion of females than males, and still, most of the individuals, we had unfortunately 7 additional deaths this past week. Many of them, as the county executive mentioned, were were nursing home residents. So again, this is that our elderly, our seniors are still very, very susceptible, and we have to take care of them. So for testing, Erie County is still offering diagnostic and antibody testing. For both to get either test, you can just call us at 716-858-2929 to schedule a test. If you want to schedule an antibody test, you also have an online option at erie.gov/COVID tests. So again, this is cost-free. You don't have to pay a dime. You don't need any type of a laboratory rec or prescription from your healthcare provider. We have clinics throughout Erie County, and remember, these are for the diagnostic test, for the nose swabs. These are by appointment only. So these are, a hot commodity, especially with schools open. Families want to know if their kids have symptoms, if they have COVID-19 or not, so they can return them to school. So if you do have an appointment, please make sure you make it, and if you can't make it, please call us so we can cancel it. So for the antibody testing, we're taking walk-ins. It's not a problem. However, for the swab testing, for the diagnostic testing, please make an appointment. So our test sites, again, are throughout the county. So for our diagnostic testing, the nose swabs, we're still in Williamsville on Monday, Orchard Park on Wednesdays, and back in Buffalo on Thursdays. And for our antibody testing sites, we are rotating throughout the county, throughout the months. So we are upcoming going to be in Collins, South Wales, in Orchard Park, and in North Collins. So those folks that are interested in an antibody test, just want to know if you've been exposed, we are happy to test you. So we are really excited that thank you to the New York State Health Department. We really appreciate your generous gift of 6 of the Abbott ID Now point of care tests. So remember, the governor deployed some of these ID Now point of care tests to our community a couple weeks ago with the SWAT team. And so we are able to keep 6 of them here. And so we're working very hard in our public health lab to make these available. We have we've just finished validating those tests, those machines, and we are training staff now to use them. We have 4,000 test kits to go through, so we're going to have a lot of availability to do this testing. So we plan on deploying them to hotspots within Erie counties that can include, outbreaks in specific neighborhoods, at specific businesses, at specific schools, where we feel that there is a need. And so we're really excited that we're going to have these point-of-care tests. So I know the way the state was running them is that people were able to receive their test results before they leave. However, we want to do everything we can to avoid any type of gathering of groups of people in one small area. So we will be running the tests on site. However, we will ask people just to, after they are swabbed, just to go home, and we will call them the same day with their test results. And so it'll be great, especially in a school setting where, say, a child is symptomatic, and the parent wants to, wants to know if they have COVID-19 or not, if they can return them to school. Do they have COVID-19, or do they just have a cold, or something else? So, so hopefully we will be able to give them their test results on that same day. So we're really excited about that. But also, we still maintain information about what we hope are all the diagnostic testing and antibody testing sites in the county on our Erie COVID test site map. So again, you can click on the stars or the dots on the map and find a testing location near you, and the window will pop up when you click on a dot and tell you all the information about the testing sites, the hour of operation, whether you need insurance, whether you need a provider prescription, and the hours of operation and the type of tests that they do. So we are still the governor still has a travel advisory out that warning New York State residents about traveling to states that have a very high prevalence of COVID-19 in that state. So fortunately, we have some states that are frequently visited that have come off the list. However, Puerto Rico was added. So, please, if people are thinking about traveling to these areas, please think twice. I mean, we are getting people returning from those areas who are getting diagnosed with COVID-19. It is not worth it. There are a lot of other beautiful places to go. You can see there's the number of gray states are growing. Just even taking a holiday in New York State, there's so many beautiful places. So please think twice about it. It's really not worth it. And so if, also the New York State Health Department has staff that are positioned in the Buffalo Niagara Airport, and they are waiting for you when you deplane from a plane that is directly coming from one of the states in red. And so there'll be an enforcement agent and somebody from the health department that will be collecting, hopefully, your form that has already been completed, and entering that into New York State Health Department's ComCare database, and to place those individuals in quarantine for 14 days, and you will be contacted by either a contact tracer or by notified by letter that you are in quarantine. So please, if you do travel and if you do return, please stay in quarantine. Please don't expose other people, and please get a test so you can know your status. So just going to talk about Erie County Responds. So I'm going to talk about how we are working with the schools, so the K through 12 and the colleges. So schools open. I know I have kids in school now too. The COVID-19 among students and staff in a school situation is very, very complicated. I mean, we all have the same goal. We all want to keep students and staff and their families healthy and safe. And we all want to keep schools open, and we want students who are able to be able to attend school as much as possible. And we developed these policies and procedures for isolation and quarantine and recommending testing with those ideas in mind. We have been meeting very frequently with both university leaders. We've had calls with University of Buffalo and with the other colleges and universities in area. And recently, now that the K through 12 have opened, we've been having frequent calls with the school superintendents. Actually, today we had calls with Erie 1 and 2 BOCES and all their superintendents to just explain our policies and answer any questions. Again, it is very complicated, and it's both an art and a science. So it's there are many things that we have to take into account. We have to think about not only distance from the students and the staff from each other. We have to think about if they're wearing masks. We have to think about, say, the age. I mean, hygiene of younger kids are going to be different than the hygiene of older kids. We have to think about the duration of exposure, how long they were sitting in a classroom together. So there are a lot of things that we have to think about, and it's just not like one kind of cookie cutter formula. So it's very, very complicated. The governor has started a new report card for schools so that everybody will be able to be aware of the number of students and staff in each school that have been tested and have been diagnosed with COVID-19. So we want to have full transparency so families in the community will know what the prevalence is in their school. And then, again, COVID-19 not only affects school, it also affects businesses. And isolation and quarantine can be very difficult to understand and very disruptive in the workforce. So we are offering a free webinar for small business owners, just to explain, what they need to know about contact tracing and the terms of isolation and quarantine, and what's an essential employee and what's a non-essential employee, and who's best to work at home, and if they're essential employer, how they can come to work and still keep the rest of the business safe, and then going over the legal aspects of this. So again, it's very, very complicated. It's not easy. So we are going to be working with our partners. I'm going to be doing this presentation with Jennifer Scharf, from a lawyer from Coppola Law Firm, and just to hopefully help small businesses understand what the terms of engagement are, just to make it easier for them, and so they can be prepared and know what to expect. So I'm sure you also know, and probably some of you are very excited, that gyms and fitness centers and pools are open again. We have been able to hire additional public health sanitarians to help us with this new large task of inspecting all the gyms and fitness centers and pools that are open now in Erie County. So far, since we started with this venture, we have completed almost 100 inspections of gyms, fitness centers, and pools. There were 12 sites that needed some follow-up inspections, and we had one inspection that was not compliant. Whoops, here we go. So so 76 were satisfactory. 12 of the follow-up inspections were satisfactory. We had 2 facilities that actually voluntarily closed, and we had 6 unsatisfactory inspections, and we are going to re-inspect them. Again, we want everything to be open. So what our sanitarians do is, go through the site. If there's a problem, they explain to them what they need to do to correct it. Hopefully, they can correct it on site. If they can, they cannot, they give them some time to correct it and then return for follow-up, just like we do with the restaurants. So if, we are still taking complaints around COVID-19, and the county is taking them for restaurants, bars, and now for gyms. So you can call our environmental health office at 716-961-6800, or go to our website at erie.gov/health, and there's a complaint form for there if you want to report any type of restaurant or bar, or now a fitness center. Also, you can also call the New York State phone number for the hotline at 833-208-4160, or you can text them at 855-904-5036. Also, for any other types of businesses that you have complaints about, you can call the New York Pause at 833-789-0470, or you can complete their online form, or you can go directly to the municipal building inspector, or call your local town, city, or village for direction to investigate that complaint. So I'm going to turn it over to the county executive to talk about the census, and then talk about the importance of flu vaccine.
We have 2 weeks. 2 weeks until the census is complete. Enumerators are on the street. They're talking to individuals who did not self-respond. Our self-response rate in Erie County is pretty good. It wasn't all that great in some communities, including the city of Buffalo.
Fortunately, the good thing, there are very few good outcomes with COVID-19 pandemic. However, one of the positive outcomes, I think, is that we are wearing masks now. So masks protect against COVID-19. They also protect against influenza. Social distancing, being far away from each other, being in outdoor spaces, can protect against COVID-19. It also protects against influenza, washing your hands, disinfecting frequently touched surfaces, protects against COVID-19 and influenza. We know in the southern hemisphere where they're pretty much wrapping up their flu season, they've had lower numbers of influenza compared to years past because they have been using these preventive measures, and so we hope that we will have the same experience. However, one preventive measure for influenza that we don't have for COVID-19 is the immunization. So it's really, really important. Also for parents, it's you want your kids to go to school as much as they can, and you also know that if they have any type of respiratory symptoms, they will have to be excluded until they have either 10 days have passed or they've have a negative COVID-19 test. So if they get an influenza vaccine, that will hopefully be one less reason that would cause a runny nose or a reason that a child would have to be excluded from school because of symptoms. So that you can kind of chalk that off the list of a cause of respiratory symptoms, and hopefully your children will be healthier during the flu season. So it's really, really important for everybody to get a flu vaccine. And for people that don't like needles, the flu mist, the nasal spray is back, and CDC is also recommending the nasal spray this year. So if you're between the ages of 2 through 49 years and there's no other contraindication reasons you don't like needles, that will be an option to you. So please, everybody, get a flu vaccine. It's so important, especially this year. We can't have two pandemics at the same time. So I'm going to wrap that up, and I will turn it over to the county executive for questions.
Thank you, Dr. Burstein. And one little thing, the best time to get a flu vaccine is now. Everyone 6 months and older should get the vaccine, and you can go to vaccinefinder.org to locate a place near you that will actually provide the flu vaccine. And as usual, I'll be getting my flu vaccine very soon in front of the cameras, as every year I get stabbed so that everyone else can then go do it, and I'm the one who gets it in front of the cameras. With that, I'll open up to questions on COVID-19 first.
When it comes to the new cases, is there anything that sticks out about them? City, suburban, small school district, large school district, boarding at UB?
I'll have to turn it over. I don't think there's anything in particular, but I'll turn it over to the doctor to answer it more specifically. But there's nothing that, in my knowledge, that I got a call on saying, oh boy, we got an issue that we have to deal with in a school or a business or something like that. So.
Thank you. Yeah, it's very similar to what we've seen in years past, just in terms of who we're seeing of getting infected. We're seeing a lot of young people, older adolescents, young adults, and then people in their 20s, some people in their 30s. And again, it's because of their behaviors. Living in congregate settings, say in dorm rooms, or going to large social gatherings, or just young people, young adults, older adolescents, going out. And so people traveling. I mean, we're still getting people returning from Florida, Carolinas, that end up becoming infected. So, and then again, if we've also heard these anecdotal stories where, someone will have symptoms and go get a test and then join a group and even disclose to people in the group oh, I have these symptoms, I just got a COVID test, and then nobody has a problem with that. Nobody's masking, and then boom, that person has been positive, and then everybody's exposed, and they're at risk of being positive. So just please be very, very respectful of your health. Be conscious of your health, and be respectful of of other people's health. And it's still the the same old, same old.
When it comes to contact tracing, Gail, in schools, can you give us an example of duration as an exception? You said it's a science and it's not an exact science, but I've had two school superintendents tell me that the rules suddenly changed a little bit last Friday with a 60-minute duration rule that they had never heard of, in addition to the 6 foot 10 minute thing. So give me an example of something besides 6 feet, 10 minutes that you're taking into account in a school setting?
Sure. So the question is, what are we looking for in public health in terms of considering other people in a classroom setting as exposed? So that's your question, right? So, again, we have to look at many different factors. So again, it's proximity, the age of the child, the hygiene of the, younger kids are not going to have as good hygiene as older kids. Also, with older kids, if they cough, they're more likely to have productive coughs. Also, compliance with mask wearing. We've heard from Erie 1 and 2 BOCES that at least all the public schools are requiring masks, so that's great. And then, the question that is something new that the schools were not expecting is the duration of being in the same classroom. So again, it's so we're looking at that. We're looking at the size of the classroom. So if it's just a regular size classroom, and you all know what a regular size classroom looks like. So we had to develop some. We did an extensive lit review and took different pieces of science, scientific literature, and tried to put it together and tried to develop just some type of objective, standard or criteria of just to start looking at, okay, when are we going to start to be concerned that these other people in the classroom could have been exposed. And remember, in the backdrop of this, Western New York has the highest proportion of positive tests in the state. So we have to be very, very conservative. So as a starting point right now in a regular sized classroom, we're looking at if there was somebody that was infected with COVID-19 in the classroom, if in a regular sized classroom, if the duration of exposure was longer than 60 minutes, then we are concerned that there could be significant exposure. So we are telling everybody in that classroom that they should go home, do virtual learning or virtual teaching for 14 days and get a test. So, again, is it, 59, 61, again, it's not like a hard 60 minutes. We have to take many things into account. And then say at, universities have these like huge classrooms, like at Jacobs School of Medicine, I think they can accommodate almost like 300 people in a class. And so there, then we're looking at more, proximities of contact. So like, 2 rows ahead, 2 rows behind, 2 seats to the right, 2 seats to the left. So again, it's not a cookie cutter. We have to look at the entire situation. And we're starting, I admit, in a conservative place. So we're also starting in an environment where we have a higher proportion of positive tests in Western New York than any other part of the state. So and we have informed the schools, the Erie 1 and 2 BOCES and the private schools that this is where we're starting. This is subject to change. I'm sure it will change over the course of the next few weeks. I was just on a call with local health department leaders and the New York State Health Department asking, the state has been promising us guidelines to help local health departments with thinking about quarantining in school settings. And, they've been telling us it'll be out any day for about a month. And so they said today, it'll be out any day. So we're, still waiting for that. So I'm sure with that additional guidance, we will end up changing with, we also might have more additional experience with our current guidance that make us change. But we have to start somewhere with a standardized approach. And we thought we had to be conservative because we have very higher numbers in our in Erie County compared to the rest of the state. And so, that's a place where start. Students are still going to have time they're still going to be able to participate in virtual learning, so we're not prohibiting learning. And this is a place we're starting just to keep kids healthy.
Sandra?
Whoops.
I had another question for you, actually.
Okay.
So how many additional health sanitarians have you hired, and what does that bring the total to? And when you say that 6 health facilities, 6 gyms got an unsatisfactory inspection, what happens to them? Does that mean that they have to close until they can they can stay open, but then they need to.
Right, so the question is, how many sanitarians have we hired, new public health sanitarians have we hired to do the gym inspections? And then the other question is, if a fitness facility receives an unsatisfactory report, what happens? What do we do with them? So first of all, I think we've hired 8 additional public health sanitarians. Let me just check on that. That's how many we've hired so far. And Carol will get back to you. And then we will, what we do is we approach this just like we do restaurants and bars. So we explain to the owners or managers of the facility, what the problems are, why they have an unsatisfactory report, and we ask them to either correct it on site if they can. If they can't, we give them some time to correct it, and then we follow up with a repeat inspection. So as I mentioned, a couple of facilities have voluntarily decided to close. They didn't think that they could do whatever they needed to do to meet the standards. But we want places to stay open, and so we're here to help them figure out how to make it work.
Leanne?
You guys have mentioned that the New York State Department of Health was giving the county 6 rapid test machines and 4,000 rapid test kits. What is the current state of diagnostic testing and PPE in the county right now? Do you guys have a surplus of supplies?
Well, let me talk about diagnostic. So the question is, what's our current status with diagnostic testing and PPE? So I'll talk about diagnostic testing, and you can take the PPE, county executive. So just in terms of diagnostic testing, we are still cranking in our Erie County Public Health Lab with our diagnostic testing with the regular PCRs that we've been doing. And, we're still doing about 500, sometimes 550 tests per week. And so we are still doing that. We have on order, and hopefully we're hoping to receive next month or the next couple months, new testing platforms, new automated equipment to make it be able to do even more diagnostic tests. So the PCR tests, the polymerase chain reaction tests, are the most sensitive COVID-19 tests available. So we do have that testing available. We have now, the state was so generously, and we really want to thank them, gave us 6 of the Abbott ID Now point of care tests. So, and we have, machines. We have 6 machines, and we have 4,000 test kits. So those are also sensitive tests. They're not as sensitive as the PCR tests that we run in our public health lab, but they're good. And so we are getting ready to be able to offer that point of care testing in the community to hotspots, to neighborhoods, to businesses, to schools if we need to. And they're mobile. They're like about 1 foot by 1 foot by 1 foot, so they're very easy to transport. They're like the size of a big toaster. So, you can look at a picture of them online. So it's something that will help us with our mobility and our agility to respond with testing to any type of outbreak. And then we still have our antibody testing, which is not a diagnostic test. So that's what we have. And we're hoping we'll be able to launch our point of care testing sometime next week.
In regards to PPE on hand, that changes daily. But we have acquired so much PPE, we've had to lease another warehouse. We have a warehouse in Cheektowaga that has been our standard warehouse, as well as our surplus supply location for decades, and we have acquired another warehouse that we've leased in the town of Amherst. It is being set up as we speak. Some of the PPE has actually been moved there. But there are hundreds of thousands of pieces of PPE that Erie County has on stock. At any one moment it'll change. For specifics, we can give it to you. We just have to go confirm with our Department of Homeland Security Emergency Services, which is in charge of the distribution. Basically, the acquisition and retention is through the Department of Purchasing, Public Works, and Homeland Security, and then Homeland Security is responsible for the dispersal of it, because it's not just kept by Erie County. We disperse it to other entities as well. But I can tell you there are hundreds of thousands of pieces of PPE between masks, gloves, gowns, other things that are needed for the COVID-19 outbreak, or for that matter, any type of other health outbreak that we have on hand. We're in a pretty good position. So as I say, we're in such a good position, we had to acquire another warehouse. And the nice thing about the warehouse has a temperature controls room. So there's a specialized area that can be temperature controlled, which we believe will be helpful in the storage of vaccines. So whenever we do get mass amounts of vaccines, we'll be able to store them in a temperature controlled location in this new warehouse in the town of Amherst that we would not have had the ability to do at our warehouse surplus location in the town of Cheektowaga.
All from overseas still?
Michael, all from overseas, you mean the PPE?
Yeah.
Well, PPE is being acquired from where we can get it. Some of it's United States produced, some of it's Canadian produced, others are overseas. When we say overseas, we're talking about Europe and China. We'd hope to acquire as much of it as we could from the United States, but truthfully, there's just not that many manufacturers of PPE in the United States, and we're getting it wherever we can. And we're getting it from primarily American-based companies, but they may be manufacturing it overseas. That's disappointing. You would have hoped that these companies would have built manufacturing locations in the United States. For example, the nitrile gloves, because of the way they're made, there's basically one major manufacturer, which is in Malaysia. Would not have thought that, but because of the process they use, there's really nowhere else that it's being done. So for the nitrile gloves, they're coming from one major manufacturer in Malaysia. It's just what we have to deal with. Any other questions on COVID?
Any pushback from school districts, private schools, charter schools, whatever, about giving you the data?
The question was, are we getting any pushback from schools, public, private, charter, whatever, with giving us the data? And the answer is no, because they have to by law.
We're giving them the data.
Yeah. What ends up happening is the data on a test that comes in with a positive comes to New York State and then goes to us. We will inform the school. They then have an obligation to let us know who are the other individuals that are potentially at risk so our contact tracers can contact them. So we get the data first about a student or a faculty member or other staff member who may be sick. We then find out, okay, they're at, we'll say at Mayberry Middle School. I don't want to say something and then people think that there's a middle school in Erie County, because there is no Mayberry Middle School in Erie County. So let's say there's a student at Mayberry Middle School that tests positive. We will then inform the school, and the school has an obligation to provide us information about the individuals that that student or whether it was a faculty member came in contact with. So then we can inform them of the responsibilities under the quarantine guidelines.
Can you give me a rough idea of what the ratio is when there's one case in one school? Is there roughly 10 for every one of those students? Or could you tell us, is it hundreds of people right now who are in, advisory quarantine because of a school possible exposure?
The question was, can we give a ratio with regards to how many individuals may have COVID-19 as a result of a positive test or are in a quarantine situation? It's really be a hypothetical. It's very difficult to say because it's going to change based on the classroom. Was it a student that was sat in one classroom the whole day, like you often will see in like a third or fourth grade? Was it a high school student that changes classrooms and changes the amount of students? So can't really give you an exact number. What I think is an important fact that we talked about today that we really haven't talked about, and we're going to be looking at going forward, is symptomatic versus asymptomatic. And as I said, roughly 60% of all individuals who tested positive over the last 2 weeks were symptomatic. So they had some symptoms. It could be as much as they had to go to the hospital to as they just felt horrible with chest congestion, so to speak. But they had symptoms. So that means 40%, though, of the people who tested positive were asymptomatic. So they're walking around the community not realizing they had COVID-19, and they can transmit it to other people. And that's the concern. So that means there are not only thousands of people in our community in all likelihood, based on the percentages, who are sick. There's also thousands of people in our community who have COVID-19 but don't feel sick. They're sick, they got the illness, but they don't know it because they don't have any symptoms. They don't feel it. So that's always been our biggest concern, and why we say wear masks and things like that, because you could have COVID-19, not know it, have a very mild case, but you go over to your parents' house and you give your mom a kiss on the cheek, and you may have just given her the kiss of death, depending on your mother's age. And as we said, we were concerned because we know the nursing homes are doing an incredible job of protecting their patients. And there's so many family members that want to get in the nursing home. But of the 7 deaths in the last week, the majority of them were in nursing home settings. That means they're catching it from someone else, because those individuals probably aren't leaving the nursing home. So someone is bringing in. Is it a staff member? It must be, because families, I shouldn't say that. Some nursing homes are allowing some families. It's varied based on the nursing home. But we're concerned about what would be considered the asymptomatic spread. Thousands of people in Erie County and in Western New York have COVID-19, don't know it. We've got over a million people, and 1.2 million in Western New York, basically. So there's thousands that probably have it, don't know it, and they can spread it on to others who would be very susceptible to an illness. So that's why we say wear a mask, wash your hands, safe, socially distant as best as you can. That's why we still send our health inspectors out to bars and restaurants. We haven't closed any, to my knowledge, in the last few days, but we have written up a number of bars and restaurants for unsafe practices, either by their patrons or their staff. So we continue to do that. I'm glad to say most bars and restaurants seem to be following the order. Not everyone does. They're not always happy when they see our sanitarians from the health department come in, but we have a responsibility to protect the public. The question was, do we know of any guidelines that would allow fans in the stadium and numbers? It's not specific with regards to a particular number. Most NFL stadiums this past weekend and this weekend will not have fans in them. It's actually an anomaly for anyone to have fans. We know people are like, well, they're having fans in Miami. The last I looked, the testing rate in Miami-Dade County was over 5% positive. And they still are not allowing you to have indoor dining in restaurants. They are doing in other parts of Florida, but not in Miami-Dade County. So if you think I'm going to fly down there and I'm going to go to a restaurant and eat inside, you're not. They're still closed. I wouldn't do it. Hearing that there are still tickets available for the game that you can buy online means that most people are not doing it even down there. I saw a statistic a couple of days ago. We've had over 100,000 cases since the beginning of the outbreak. Miami-Dade County, I believe, is at 75,000 cases alone since September 1st. Think about that. They had 3/4 as many cases since the last day of August through today, September 16th, or as of what the final date was, which I think was the 14th. I would not go down there. Not only do you have to quarantine when you come back, but you're really putting yourself at risk. The numbers are higher down there. And they're not even in, would be the phase 4 yet. I think they just entered at phase 2 in their reopening plans, is what I saw. And the decision, my understanding, was made by the governor of Florida. The local officials in Miami were not happy with it. I wouldn't go down there. And when it comes to here, it's going to based on our numbers. If they continue to go down to a point where they feel like there is a safely can bring folks in, then it would happen. The issue of sitting in the stands is not the problem. That I know, having had conversations with the Bills and reviewing their proposals, I think they can safely protect the fans in the stands if there's a small portion of them that attend. The problem is the ingress, egress, the entry, the exit, the going to the bathrooms, in the concourses in halftime. If you've ever been to a football game, and I've been to a football game, I know most of you have been to a football game, I used to have season tickets, you don't want to walk around in halftime because you can't. Everyone's like this. Now there's 70,000 people. Let's go down to, let's say, 25% of that. That's still a lot of people. It's like 17,000 people or so, 16,000 people, and you're still going to be in a tight area. We know what the bathrooms are like. I guarantee you, even at halftime, there's still going to be lines to get in the bathrooms. So the problem isn't the seating bowl. The problem is, how do you get people in and out of the stadium safely? What happens if you have an emergency and you have to get people all out at the same time? That's a big concern, because then you theoretically could have 17,000 or more with all staff leaving the stadium all at once, when right now New York still has a limited amount of individuals, even for outdoor settings. So it's going to be based on our numbers, and it's going to be based on what can be done safely. And we are really no different than almost every other NFL community that has no fans. And there's still a chance there'll be fans attending Bills games this season. If you want to go see the Las Vegas Raiders, you're not seeing them in person, because they've already announced they will not have any fans in their new stadium the whole year. A few of the other teams have done the same thing. So there's still a chance, and it all depends on our number. It's basically in our hands. If we can get that number down, and if we can show that people will be responsible, then there's a possibility that fans will attend the games.
Mark, related for Dr. Burstein, does this tell you anything about how complicated it would be to have regular high school sports with all the things the Bills have tried to go through to keep their players safe? I mean, is it any way possible to do it in a high school?
The question was, what about high school sports? And I guess it depends on the sport. I know there's some sports that are actually ongoing right now, but I couldn't answer that question. I'll turn it over to Dr. Burstein, but certain sports are just going to be more at risk than others because of the closeness of the individuals. I saw, I think it was yesterday, that Ed Ogeron, the coach of LSU, announced that almost all of his players tested positive for COVID-19. And colleges generally don't have like a set number, like 45 or 50 players. They may have 100, which only a certain number play per game. All of LSU, and he was like, I hope we can play in 11 days. I don't know how they're going to play in 11 days. And if I was on the opposing team, I don't know who LSU's first game was going to be against, but if I was on the opposing team and I was a lineman looking across at the lineman staring at me thinking, does that person have COVID-19? I'd be worried about it. So it's not our decision when it comes to high school sports or college sports. It's really in the hands of the state, as well as, especially the state. When it comes to high school, the colleges, they have our conversations with. But there's certain sports that are going to be much more difficult than others. I don't know if you want to add anything. She's fine. Okay. Any other questions? If not, everyone be safe, be well, wear your mask, complete your census if you haven't done it yet. We certainly are hoping for another Bills victory this weekend as they squish the fish, even though dolphins are mammals. But thank you, everyone. And thank you, Karen Gambino, for providing the American Sign Language. Take care.